Okay, hello everybody. Welcome to another session of What's Next After BDS. Today I have with me my senior, Dr. Ridhi, and she has been like about 3 to 4 seniors. I first remember meeting in the Prosto lab when I was struggling to do some occlusal rims, if I'm not wrong. So, ma'am, a short intro about yourself and your journey to Australia.
Thank you, Vinay. Yes, I remember seeing you back in college. Like any new person, like how we were clueless once we entered university. I remember how you were, and I tried my best to help all my juniors. My journey in Australia, well, it's an interesting one. I just met my husband in 2017, and he was living in New Zealand. So I had to figure out what needs to be done to be able to practice here in New Zealand. So I realized there are two pathways. I could either take the Canadian exam board examinations, or I could take the Australian ones.
Okay.
I preferred the Australian one, and that's when I started applying for the Australian Dental Council examination.
Okay. So the Canadian board exam is also valid here to practice in Australia and New Zealand. Okay.
Yes, that's right.
Okay.
If you are qualified dentist in Canada, you can apply for registration here in New Zealand as well as Australia.
Okay, okay. So the ADC exam is consists of two parts, right? So part one and part two. So can you just tell us how did you go about with your preparation and how different was it from what we read in our undergraduation in India?
Yeah. So the part one examination is a written exam. It's not necessarily written. It's an MCQ based exam.
Okay.
And to put it into simpler words, it is more of a clinical based exam. So you have MCQs as well as you have something called as scenario based questions, which is as simple as they give you a scenario where a patient comes in with complaints and they give you the clinical presentation, and the questions are based on those clinical presentation. So they are actually kind of judging your clinical skills
Mm-hmm.
more than the bookish language, bookish knowledge, more than what we are used to in our study pattern in India. Now, from this year, they have started. They have actually changed the part one, the type of exam in part one. So all the questions are going to be scenario based. There's no multiple choice questions now.
Okay, okay. So when it comes to scenario or MCQs, see, as far as any guidelines are, when it comes to guidelines, there are certain guidelines which we follow in India and certain guidelines comes with changes with respect to any country, not just Australia. So did you take any special tips or books to refer to in order for this preparation?
Yes, I did. So we have some specific guidelines for Australia, for practitioners in Australia. Those are called as the therapeutic guidelines.
Okay,
So that is like the Bible, which you have to know by heart. It is in and out of your clinical dentistry here.
okay,
It's not something totally different, but it does give you a general dentistry view in one complete book.
okay, okay,
Also, along with that, there is something called as an infection control protocols,
okay,
which
okay,
are very thorough here,
okay.
and I'm sure now in India as well.
Very.
But definitely, you have to follow them step by step. There were a few things. Apart from that, for all the subjects, I just followed the standard books that we used to read during our graduation.
Mm-hmm.
I did not go for any specific course as such. There are courses available. If you want to, you can enroll into one of them. And
Okay,
there are mentors who help you prepare for the exam.
okay.
What I did instead was Facebook has, free groups available where candidates come together and they discuss the questions.
Okay,
So
okay,
I felt that was helpful for me, and I also did not want to spend a lot of money in part one examination per se.
okay, okay. That's good. So, and after how many months, or is there any time limit after which you can take the part two exam after finishing part one?
It's not there's nothing like that. Once you have cleared the part one have your part 1 results, they tell you are straight away eligible for the part 2 exams.
Okay.
And in the current scenario, ever since I have been in this journey, because previously people had to wait for an year or so. But this time onwards, because they have a dedicated place where they are conducting exams,
Okay.
so the exams are going on all around the year.
Okay.
I mean, COVID scenario is different, where if the city is under lockdown, they really cannot do anything.
Okay.
But previously, before COVID, they were doing exams all around the year. Whereas in the previous pattern, exams were only conducted, if I'm not wrong, twice or 3 times a year.
Okay.
And that is when there was a long waiting period.
And what was your pattern of the exam for part 2? Part 1 is MCQs and scenario based questions correctly. When it comes to part 2?
So part 2 is, again, it's a 2-day exam.
Okay.
One of first day or one of the days is a technical skills exam, where you have to do technical tasks within 6 hours on a mannequin.
Okay.
So these involved restoration based task and preparatory based task. So if I can give you an overall view, it was like doing composite restorations, making a provisional crown, and doing amalgam restorations. And for the preparation based task, we had crown preparation, we had endo access cavity preparation, and caries preparation.
Okay.
So these things you have to do in a simulated environment, but they are watching you, and you have to behave as if you are working in a clinical scenario. So you have to follow all the infection control protocols, and you have to treat the mannequin like you would treat a patient.
Okay. Okay. And did you get, like, when it comes to the second part, as you mentioned, you said it's more of a clinical simulation. So did you get any particular place to practice whatever has to be done for the exam?
Yes. So before I come to that, I would just like to tell you the day 2 of exam is actually an OSCE exam, which
Okay.
means you have patient conversations.
Okay.
So
Okay.
and it has 6 cases. In total, there are 10 stations, out of which 6 is patient conversations, and the rest 4 are technical skills.
Okay.
Skills such as rubber dam, X-rays, LA, and so on and so forth. Yes, it is not an easy exam, and it needs a lot of practice.
Okay.
For me, I was lucky. Pre-COVID, I started preparing for part 2, and I could actually travel to India, and I could go to this overseas dental academy in Chandigarh.
Okay.
So they have the entire simulated environment like what you would get in exam, and you can actually practice on the same kind of materials, the same mannequin heads, the same teeth. Also, they do the OSCEs, the patient conversation. All of those are practiced thoroughly.
Okay.
And it was very helpful.
Okay.
As such, in New Zealand, there is no such academy where you could practice anything of that sort. There are a few in Australia.
Okay.
But for me, coming back to India was more convenient. It was also because I could visit my family, I could be with them.
Okay. Okay. That's nice. That's nice.
Yeah.
Just a minute, ma'am. Just a minute. Sorry. Sorry. Okay. So how difficult was taking up these exams, ma'am? You think it was straightforward, or they actually look into minor aspects also about your what are tooth preparation, LA, the skills basically? I'm asking about that.
Absolutely. They're very precise. Uh, like when you are performing a skill, an examiner is watching you. He's right on your head.
Okay.
So you cannot go wrong.
Okay. Okay.
All this, they have particular marking rubrics, like what all things they are seeing in your task.
Okay.
Whether it is a technical task or a conversation task or a technical skill task.
Okay.
And you need to tick all the boxes.
Okay.
So when I say tick all the boxes, actually their marking system is not very clear. You don't know what is their cutoff, whether it is 90%, whether it is 80%, or what.
Okay.
But to give you an overall view, it is a challenging exam.
Okay.
And at the same time, practice will help.
Okay.
So I'm not going to discourage anyone and say it's very difficult,
Okay.
but I would definitely recommend practice is the key.
How much time will you say is it required to, for both, especially part two, actually? So, I mean, a minimum amount
Um,
of time. I'm sure it varies from person to person, but some minimum amount of time.
well, I would say if you are 100% dedicated and if you do not have any other commitments, like you're not working full time and you are able to put in those hours each day, then at least 3 months
Okay.
minimum.
Okay.
Yeah.
That's good. That's good. And what about the fee structure, ma'am? Cost of the exams for part one and part two?
So the cost for part one is 2000 Australian dollars,
Okay.
which is if you multiply by 50, it comes out to be roughly. uh, um, sorry, we are not people from the maths background.
Yes, ma'am. For 2000 means should be about,
1 lakh rupees.
yeah, about a lakh.
Yeah.
Okay.
And the part two exam is $4,500, which
Okay.
is another 2,25,000.
Okay. Oh, wow.
Uh, Plus, it involves travel to Australia because part two is only done in Melbourne. You can
Okay.
only take that exam in Melbourne. So there is travel, there is visa. And during the preparatory stage, you have to buy all the materials. You have to create that simulated environment at home.
Okay.
So that is another investment.
Okay. Okay. That's good. And just suppose somebody clears part one and is not able to clear part two. Do they have to write part one again, or they have some number of attempts when it comes to writing part two?
So your part one exam is valid for 3 years.
Okay.
Within those 3 year period, you are supposed to clear your part two.
Okay. Okay.
If unfortunately for some reason you are not able to do that, then you may have to take the part one exam again.
Okay. Okay. Part one, you have to repeat your part one. Okay.
Yes.
Okay. So that's it. Do you think is there anything else which you'd like to tell, because to for someone who wants to settle down in Australia for starting up their dental career, is there anything else you would like to tell them?
Well, it is not something impossible.
Okay.
That is first thing. It is definitely doable. It
Okay.
requires a lot of hard work.
Okay.
And yes, you need to be focused. You just need to be focused.
Okay. Okay. That's good. And if somebody wants to do their masters after finishing the general dentistry thing, is there any separate other exam for this, and how does it go about from here?
So if you are already a master's degree in India, if you already have a master's degree in India, that is not recognized here.
Okay.
You still have to still sit these general dentist examination and you will be registered as a general dentist.
Okay.
To have the master's here, you need to study further for 4 more years. So master's here is for 4 years.
Okay. Okay. So
So you'll have to take up that.
you're planning to do some masters, ma'am?
In a few years, yes.
Okay.
Not immediately, but yeah, in a few years' time.
Okay, ma'am. That's nice talking to you, Dr. Ridhi, ma'am. And is it okay if I can share your email ID so that if somebody is interested, they can contact you?
Absolutely, absolutely. I would be happy to help. And if just feel free to ask me anything on my email.
Okay. Thank you so much, ma'am. Nice talking to you. It's good.
Same here, Vinay.
Yeah. Take care, ma'am.
Take care. You stay safe.
Yeah, you too, ma'am.